My name is Penny Reed and I have multiple sclerosis.
My name is Alex Lobo. I'm about 80 years old. I've had Parkinson's for the past 11 years.
I'm Wayne Arsenault. I'm 62 years of age. I had an accident in 2007 involving a dirt bike. I had to go to the neurological unit in Ottawa because I'd had a brain injury.
My name is Wendy Morris and I'm 46 years old and I am a mother of 2 kids and I have epilepsy.
My name is Lauren Dubois and I'm a social service worker here in Toronto. I work with people with special needs and I myself have epilepsy.
The brain is a complex organ made up of billions of neurons. Of all the organs in the human body, the brain is the least understood. This lack of understanding is a significant problem, especially when you consider that over 3.6 million Canadians live with a neurological condition, injury, or disorder. Perhaps you know someone with Parkinson's disease, Rett syndrome, multiple sclerosis, or epilepsy. There are about 1,000 known brain conditions, and living with any one of them often creates serious, long-term impacts on a person's quality of life, general health, work status, and financial security. Not to mention the added burden of social stigmatization. Did you know limitations on everyday activities were experienced by nearly 90% of Canadians, aged 15 years and older, living with a neurological condition?
In my case, it started with tremor in my left hand. It affected my walking on one side, again, left-hand side. And that's when it really starts hitting you. The tremor doesn't bother one so much as the rigidity of the arm. Now that's very discomforting, actually.
When I was first diagnosed, what I heard from anyone that I told was, "But you look so normal, you look great. I don't see anything wrong with you." And at the time it was true. I had some blindness in one eye, which I recovered from. And then MS kind of went into a remission for 10 years. And then it was really only the last couple of years I started experiencing more visible signs of MS with my walking, my balance. But the cognitive issues, you don't see.
Lots of people don't know. They assume that I'm under some type of influence when I'm having a seizure. So it's embarrassing if I do something like take off my clothes or wet myself, or really, really unusual things that I do.
It was hard to control myself. I couldn't control my emotions. I was in distress a lot of the time, and I didn't know why. That was the biggest problem. Was I would have these feelings and I didn't know why I was having them. I blew up for no reason whatsoever at the least little thing.
My daughter didn't want to be at home. I was always trying to be calm and walk away, but again I felt like it was verbal abuse. It was terrible, sometimes lashing out and throwing things, and you know, even a grab here and there that you go, this is not characteristic of my husband.
Epilepsy is a brain condition. I have tonic-clonic seizures where I drop on the ground and I convulse, shake, and lately foam at the mouth. I might actually give a friend a black eye. And it can go one seizure into the next and make you very exhausted.
Real challenges also exist for the families, friends, and neighbors who support loved ones with a neurological condition at home or in continuing care, as they help with tasks such as transportation, personal care, cooking, and supervision. Family caregivers often experience a tremendous amount of emotional and financial stress, and these stressors often increase over time as dependency levels increase. Did you know the cost for caring for loved ones with a neurological condition in home care programs and in chronic care facilities are higher than those of other health conditions?
Okay, I've got one son in Vancouver and one in Toronto. They're very supportive of my condition. They've accepted it, and they will, should I need any help, they'll always be there for me.
I got really good at giving answers that didn't give a lot of information, or just even sometimes saying I'm fine. And I was able to do that because I had a strong support network, and I had MS self-help groups that I belonged to, so I had a community to talk to, which is key because it's not easy to talk about with anyone other than others that have it often.
I think I was lashing out at them for what was wrong with me, and I didn't know it. She was really not wanting to be around me, and that was understandable. Now it's understandable. With the help of therapy and a lot of good support, we've redeveloped our relationship. It's not the same as it was, but it's still there as a loving father-daughter type relationship.
The financial strain in these situations cannot be overstated. People living with a chronic neurological condition use more and costlier healthcare services than those living with other chronic conditions. If you think about it, it makes sense. Consider the fact that the number of hospital and specialist visits and the need for social and counseling services are higher for people living with a neurological condition. Beyond out-of-pocket costs to the patient, neurological conditions have a broad financial impact on the Canadian healthcare system.
The medication is very expensive if you don't have any insurance or can't afford it.
Did you know, excluding those who suffer from migraines, 25% of the working age population living with neurological conditions are unable to return to work? It's a rate 12 times higher than among those without neurological conditions.
We tried to keep on with our business, and we ran a session, and it was a total disaster. My role is to be totally transparent in the room, because I handle the technology and make sure there's no problems. And we had to actually empty the room because I couldn't concentrate with any noise that was around. And of course, I've been doing it for 15 years, so
Wayne was perspiring and sweating over the computers and physically almost shaking when he couldn't solve a problem. So that's when we realized
there's something wrong.
There's something really wrong here.
In the last year, I stopped working. I was making too many mistakes at work. I was having difficulty concentrating. I really became a liability.
As time went by, I was getting more and more exhausted, tired. It was getting tiring, less energy, and that's what I decided to discontinue working.
You're now told that you have a condition, then you have medication, and the medications comes with so many side effects, and you start hating your partner and hating people around you. But these are, after a while I learned these are just symptoms of the medications. And I've went through a lot of different medications.
I'm Sarah Gilsher. I am a health services researcher. I study health inequities in Canada, and my role in the NHCC study was I was an active co-investigator in the development of the study and the collection of the data and dissemination of the results. I think some of the biggest surprises that we had were related to differences in how care is delivered across Canada and the quality of care, and really the unmet needs that individuals have across Canada when we're thinking about neurological conditions. So when we think about health care versus sick care, for instance, I'd like to think about well-being and how do we provide care for individuals to live well. So it's beyond health care specifically, and I think that's one of the things that really came out of our research was the need for a realignment of and rethinking of how we deliver care and what constitutes care and well-being.
As more people become aware of how prevalent neurological conditions are, the more we will see the importance of research, prevention, and proper care. Visit www.mybrainmatters.ca and learn more about mapping connections and understanding neurological conditions in Canada.